Hi, my name is Shannon Rowe. I am a student here at Indiana State with the Doctorate in Athletic Training program, and today we're going to be talking about prevention. So, prevention is something that athletic trainers like to use to potentially see into the future of possible injuries for specific individuals. Prevention or screening tools should be used before any physical activity or risk to injury. So usually during your PPE or any physical before interacting or participating in any physical activity. So today I'm going to be talking to you regarding the upper extremity, the shoulder and elbow. I want to talk about the prevention screening tool of passive range of motion. So passive range of motion is pretty simple. It sounds just like how it is. You're just going to be assessing internal, external, and range of, or rotation, and as well as horizontal adduction. So with these three different movements, we're going to be looking and making sure that the patient is staying in a stationary area, and then we're using two clinicians. One will be actually putting the patient into motion, and the other clinician will be measuring with a goniometer. So I will demonstrate, and you'll also see my awesome assistants. Hello. So first you'll have the patient supine, and one clinician will have the patient putting them into motion, and the other clinician will then be measuring. So first we'll do internal range of motion. You want to make sure that the shoulder is staying in that 90 degrees, and then measuring. Okay, and then now let's go into external range of motion. Good. All right. And then the last one we want to do is horizontal adduction. Good. All right. So with this technique, we want to make sure that we are looking for any deficits. So in current literature, they talk about how any deficit between the internal or horizontal adduction of any deficit greater than or equal to 25 degrees, the participant or the patient is more susceptible to injury. So we want to make sure as clinicians that we're looking for those numbers, performing this easy, simple task before the patient participates in any activity. A lot of research has used this screening tool for shoulder and also elbow injury. So patients who did this screening tool, they found that patients with a deficit of internal and horizontal adduction were more likely, 4 times more likely to have an injury to their shoulder or elbow. If you have any questions, please let me know, and thank you for listening.